Critical care surgery is basically anything that involves complex surgical care, anything that may involve the intensive care unit, to include trauma cases. The residency program is a benefit to the community for several reasons. Number one, without the residency program, we couldn't have a level 1 trauma center. That's one of the distinctions. And number two, residency education is equated to excellence in patient care as well as education. If you look nationally across the country, the hospitals that give the best care are associated with residency programs because they are actively involved in research, education, and a multitude of other endeavors all associated with the residency. Basically, this is training the people who are going to be taking care of us and our children in the future. I've trained at some of the bigger programs, and I've been at some of the biggest programs across the country, and the quality of care that we deliver here is equal to or better than some of the other places. I mean, I think the quality of care across the line is good, but in terms of attention from attending and resident physicians on a personal level, it's much better here. I mean, you actually get to see the people who are taking care of you. It's more of a, I don't know how to put it, a big city endeavor in a small town. I mean, it's just got this small town twist to it. The quality is as good or better. If you look at our outcomes across the state, we're in the top 10% across the state, even compared to the larger centers. Technology has made leaps and bounds, but you can't take anything away from the fact that the physician's still the physician. I mean, quality care starts with the quality physician, and you need to be able to assess and examine patients before you can determine what technology to apply to those patients. It's made it easier for us to take care of some of the more complex entities, but it's also made it easier for some people to rely a lot on the technology. We use it when it's appropriate and don't overuse it or abuse it when it's not necessary. Obviously, patient care is benefited from that. The patients spend less time in the hospital, they get back to work quicker, they suffer less discomfort in general. And you know, we continue to push the envelope here. Everything that's being done anywhere minimally invasive we're doing when it's appropriate to be done. So I think technology can be good when it's applied appropriately, but and I think we do that to a decent. We do a good job of that here. I think, again, the quality of care here is second to none as far as I'm concerned. But you can get that quality without paying any of the other expenses, such as lack of attention to the lack of other physicians paying attention to you. I think Memorial Medical Center is good at providing quality medical care, but it's good at providing personal care as well. I mean, we sit down and talk with our patients. We take time with the patients. We don't rush them through basically just to increase the numbers. I mean, when you are the patient and sitting in front of us, you are the only patient that we are taking care of at that time, and that's where our efforts are devoted to.